Patricia Zahn, physical therapist and owner of TheraHab Fitness. TheraHab Fitness is so excited to be partnering with the Arthritis Foundation to provide a pain management series during the month of May, which is Arthritis Awareness Month. For this week, we are going to be focusing on back pain. So all week long, we're going to be providing specific workouts you can do that will help improve the strength of your back, help improve your flexibility, help improve your core strength, so you can move and feel better and reduce your back pain. In addition to that, we're providing smaller videos, just quick little tips of very helpful things you can do, simple things to incorporate into your daily routine that over time, done every day, will have a big impact in improving your back pain and the way you feel and move. So we look forward to having you join us in this exercise series. All right, so for this class, we need to have the yoga belt and a TheraBand, a stretchy band material. If you'd like to have some light weights, these are 1 pound. That's perfect to add a little bit more resistance. And then a little ball for some exercises. So that is all the equipment that we will need. I'm going to put it back here. And let's go ahead and lie flat on your back using a little towel behind your head so that your neck can remain in neutral. Straighten your legs and reach overhead. Reach all the way up, take a deep breath in, stretching up as though you're trying to reach an object, feeling your spine elongate, and relax. Now reach up with the right arm. I want you to reach up as though you're trying to reach an object, and relax. Deep breath in, reach up with that left arm, stretching up as though you're reaching an object, really lengthening, and relax. Now place your arms by your side. Let's bend both knees. And so now you're in what we would call hook line position. So in this position, we're going to begin by warming up your lumbar spine region. So you're going to go into posterior pelvic tilt, basically tucking your belly button in towards your spine, and then you're going to go into anterior tilt, rounding your back the opposite direction. So really tilting that pelvis, flattening your back, and opposite direction into anterior pelvic tilt. One more time, rounding that pelvis into posterior pelvic tilt, and opposite direction, anterior tilt. Now we will find the neutral spine by tilting the pelvis, going into posterior pelvic tilt to the end range of motion, and you'll drop that back just a little here. And so now you're in the neutral spine position. My back is flat on the mat. I feel these abdominals contracting so that they are engaged, and I'm going to maintain that. And this is the foundation of this entire program, where you're going to maintain these abdominals tight, providing a brace for your spine. Hold that position, back flat, abdominals tight, and let's try to alternate an arm and leg lift the entire time. You're really keeping that low back pressed to the mat. Refocusing here. Now let's do 2 more. And last one. Take a nice deep breath in and exhale. Once again, let's find the neutral spine, posterior pelvic tilt, dropping that back, flattening the mat against the, flattening the back against the mat. Let's straighten your right leg, and you're going to maintain that pelvic tilt, tight abdominals, while you do a straight leg raise. Now, if you'd like to make that a little bit harder, what you could do is add an abdominal crunch as well by placing one hand behind your head, and you're going to lift straight up towards the ceiling, holding it up for a count of 3, and then lower back down again. So I'm going to go ahead and count, Hold 2, 3 for 1. And lift. Hold 2, 3 for 2. Notice I am not pulling on my neck in any way. Hold 2, 3 for 3. I am just lifting straight up towards the ceiling, lifting my head and shoulder blades up. Hold 2, 3 for 4. I'm not lifting my leg up really high, just really as high as the opposite knee. Hold 2, 3 for 5. Nice and controlled, flattening my back. Hold 2, 3 for 6. Hold 2, 3 for 7. Hold 2, 3 for 8. Hold 2, 3 for 9. And then hold 2, 3 for 10. Very good. Bring that leg in. Take a good deep breath in. And exhale. And now opposite side. Once again, beginning with that neutral spine, holding the abdominals nice and tight. Place that hand behind your head. Extend the left leg. And you're going to lift your head and shoulders straight up towards the ceiling, doing that straight leg raise. Hold 2, 3 for 1. Hold 2, 3 for 2. Hold 2, 3 for 3. Hold 2, 3 for 4. Hold 2, 3 for 5. Hold 2, 3 for 6. Hold 2, 3 for 7. Hold 2, 3 for 8. Hold 2, 3 for 9. And then last one, hold 2, 3 for 10. Very good. Let's put that foot back flat on the mat. Put your arms to your side. Take that good deep breath in, allowing your belly to expand up into your ribs. And then exhale slowly. Now we're moving on to a bridge. You're going to push with your feet, lifting your bottom all the way up as high as you can here. If you'd like to make it harder, you can raise up your arms, taking your elbows off of the mat. So we'll lift up here and hold it. Hold 2, 3 for 1. I like to kind of come up on my heels, and that kind of allows me to really isolate the glutes muscles. Hold 2, 3 for 2. Hold 2, 3 for 3. Hold 2, 3 for 4. Hold 2, 3 for 5. Hold 2, 3 for 6. Hold 2, 3 for 7. Hold 2, 3 for 8. Hold 2, 3 for 9. And then one more. Hold 2, 3 for 10. Good. Let's take the knees and hug the knees into your chest for a gentle low back stretch. You can rock the pelvis just a little bit. That we call that pelvic clocks. So I'm just going in a gentle little circle with my pelvis. You can go to the right and to the left. And now let's take our TheraBand here. So you're going to take that band and tie that nice and tightly around your knees. Okay. and place your knees together and your feet together. And we're going to go into some hip abduction. So you're going to tighten up, doing your posterior pelvic tilt, neutral spine position, holding those abdominals nice and tight. I want you to maintain that. And then I'd like for you to try to add a Kegel exercise. So a Kegel is basically a tightening of the pelvic floor muscles. So as though you're holding in, as though you're trying not to pass gas. So you're going to hold that, hold a Kegel, and see if you can maintain that while you gently push the knees out to the side, keeping the low back flat to the mat, and then slowly bring it back in. And relax. Now Kegel, tighten the pelvic floor muscles, pull the knees out to the side, hold 2, 3 for 2, and relax. Push out, hold 2, 3 for 3, and relax. Make sure you're maintaining the neutral spine, and pull out to the side, hold 2, 3 for 4, and relax. Pull out, hold 2, 3 for 5, and relax. Hold 2, 3 for 6, and relax. Push out, hold 2, 3 for 7, and relax. Hold 2, 3 for 8, and relax. Push out, hold 2, 3 for 9, and relax. And one more, push out, hold 2, 3 for 10. Good. Put the arms to your side, take a good deep breath in, and exhale. Now, let's lift all the way up into a bridge. You may need to adjust. I notice my TheraBand is slipping just a little bit. I'm going to adjust it. So you're going to lift all the way up into your bridge, and then I want you to take your knees out to the side, hold for 3, bring them back in, and lower down again. Okay, so you're going to lift all the way up, knees come out, hold 2, 3 for 2, back in, and down. Okay, lift up, take the knees out, hold 2, 3 for 3, and down. Lift up, hold 2, 3 for 4, and down. Lift up, hold 2, 3 for 5, and down. Lift up, hold 2, 3 for 6, and down. Lift up, hold 2, 3 for 7, and down. Lift up, hold 2, 3 for 8, and down. Lift up, hold 2, 3 for 9, and down. And then last one, lift up, hold 2, 3 for 10, and back down. Good. Okay, let's take the band off of the knees. Once again, a nice little quick stretch here, pulling the knees in towards the chest. And place the feet back down. And now we're going to take the ball, place that ball between your knees, and we're going to do another combination exercise, lifting up into that bridge. When you get up into the bridge, I want you to squeeze your knees together, squeezing against the ball. If you don't have a ball, you could use a pillow, or you could just simply squeeze against your knees. But you're going to squeeze your knees together and do a Kegel at the same time. So tightening the pelvic floor, squeezing the knees together, holding for 3, and then we'll lower back down again. So let's lift up, squeeze, hold, 2, 3 for 1, and down. Lift up, hold, 2, 3 for 2, and down. Lift up, hold, 2, 3 for 3, and down. Lift up, hold, 2, 3 for 4, and down. Lift up, hold, 2, 3 for 5, and down. And lift, hold, 2, 3 for 6, and down. And lift, hold, 2, 3 for 7, and down. Lift, hold, 2, 3 for 8, and down. And lift, hold, 2, 3 for 9, and down. And then last one, lift up, hold, 2, 3 for 10, and down. Good. Okay, we'll take the ball, place that over to the side. Now, place your knees together, feet together, and we're going to do some trunk rotations. So what I'd like for you to do, you can put your arms out to the side here, and you're going to simply take your knees down to one side, feeling a good stretch, and then I want you to concentrate to use your abdominal muscles to gently pull those knees all the way back over, and then over to the other side. And use those abdominals to pull the knees all the way back over. Good. Pull the knees over. Now, if you'd like to make that a little bit harder, you can gently lift the feet up. You need to make sure that as you come, coming back to the midline, that you're keeping your low back pressed to the mat as you're bringing your knees from side to side. If you find that you feel that your back is arching, you need to go back to the beginning method, which would just be having your feet on the floor and then using those abdominals to really pull those knees from side to side. So start with this. If that feels too easy, then you could try the method where you lift your feet off of the ground. Use those abdominals, now flattening that back to the mat. And then I'm going to pull back, flattening the back to the mat. Good, let's do 2 more. And last one. Okay, good. We'll put our feet back on the floor here. Let's straighten out the left leg. Take the right knee and hug that knee into your chest to get a nice gentle stretch. If you'd like to bring your shoulders up a little, you could do that just to increase the stretch. And then other side, pull that knee in. Good. Let's take both knees, pull both knees in. And then let's move into some stretches. I'd like for you to get your yoga belt, and we're going to put that yoga belt around your foot, holding on to the straps here. You're going to take the yoga belt and then pull up, feeling a good stretch in the hamstring. Now you don't want to pull up so high that you're bending your knee. You're going to hold on to the yoga belt and simply pull up here, feeling some good tension in the back of the thigh. Getting a good stretch right here, the hamstring. And you can take a good deep breath in. Inhale. And then as you exhale, see if you can gently pull just a little bit more. So you're using your breath to assist with that stretch. So that's really stretching that hamstring. You want to hold these stretches for about 30 seconds, really to get the benefit of that good stretch. Now, next stretch is going to be for the inner thigh. There's two ways you can do this. I'm going to show you kind of the beginner way, which would be simply straightening your leg and then taking your leg out to the side this way. Okay, so that's one way to do it. Another way would be to go from this straight leg raise, holding your arm out to the side, keeping that hip down towards the mat, the opposite hip. So you want that left hip down towards the mat. You're taking that right leg out to the side, and you're feeling a good stretch in the inner thigh. And make sure you're taking some good deep breaths as you're stretching here. Holding it to really get the benefit of the stretch. Now we can take that, use your band, pull that leg all the way over, and at this point you're going to transfer the band into your left hand. Take the right arm out to the side here, anchoring this shoulder, the right shoulder down, and you're going to allow that hip and knee to cross over, and now you should be feeling a really good stretch through the hip, through the piriformis area, also here through the low back, really getting a nice stretch. So with this particular stretch, I like to start with the knee up higher. So you see my knee is up higher towards my body, towards my head, and I'm really getting that good stretch to the piriformis. And that piriformis would be this small muscle group here that's kind of a diagonal muscle that lies right in your hip and gluteal region here. Now from here, we're going to move to the iliotibial band stretch. So stretching the muscle here that's on the outside of the thigh. So you're going to straighten the leg now and continue. You can hold on to that strap. And you're straightening the leg and rotating your right hip backward. So you know you're doing this properly if you're feeling a stretch on the outside of the thigh here. It's a really good stretch, really important muscle group to stretch. It's a common tightness of that iliotibial band can really lead to a lot of knee pain or hip pain. Okay, now then let's bring that leg back in, and then we'll change sides. So now I want you to put the other foot up. You're going to hold on to the strap, stretching your hamstring to begin with. So you can take the opposite arm out or just hold it to your side. Make sure you're not pulling up so high that you're bending your knee. That would be defeating the purpose. You want to have that leg straight. Pull up and feel till you feel some tension. Now here you can take a good deep breath in, inhale, and then exhale, pulling just a little bit more, and you're getting that good stretch for the hamstring, using your breath to assist with your stretching. Now hold it here as you really feel that muscle stretching. Okay, now then to stretch that inner thigh, you can lower the leg and pull out to the side this way, or you could go directly from that hamstring stretch, carefully allowing that leg to drop out to the side, holding your opposite arm out to the side to kind of anchor that side of your body, making sure that your right hip is not rotating up. You want to keep that right hip down, feeling a good stretch in the adductor muscle, so right here in the inner thigh. Feeling that good stretch in the inner thigh. Okay, from here, you're going to gently pull that leg across your body. You'll change hands, so now you're holding onto the band with the right hand. Keep that knee up a little bit higher as you allow the leg to rotate across the body. You've reached out to the with the left arm, kind of anchoring that shoulder blade down. Really feeling a good stretch here through the piriformis region here and through the low back. Now then straighten the leg out and then allow that hip to drop down, and now we're stretching that iliotibial band. So you've straightened the leg, feeling a stretch kind of right here along the hip and then down the outside of the thigh. Make certain that you're rotating that hip posteriorly or backward here on the left. If you're too far forward, you're not going to feel it. So that hip needs to be rotating back, and you should feel it down the outside of your thigh there. Okay, very good. Let's go ahead and pull this leg in. And then from here, let's roll over onto our stomach. And you're going to roll all the way onto your stomach, and let's come and push up onto your elbows. So here I'm on my elbows, and I'm going to gently push my elbows into the mat, and as I'm doing that, I'm feeling an increase in stretch in my low back. You can also, if you're comfortable with this, gently push up just a little to increase that extension stretch. Okay. And then I'd like for you to take the towel, and you're going to roll this towel up, and you'll put it right on your forehead. And also, if you'd like to make this particular exercise a little bit harder, you could have your weights handy. Let's try it without the weights to begin with. If it feels too easy, then you could reach for the weights. So you're going to put the towel right on your forehead. Put your hands by your side here, and we're going to strengthen the upper back by lifting the hands up, squeezing the shoulder blades back together. So if you want to make that harder, you can actually lift your head up as well while you lift the arms up. And another option for harder still, you could actually lift your feet up, really strengthening the back. And one further option would be if you would like to hold on to your arm weight. So I'm going to demonstrate without holding onto a weight. I think that can be challenging in and of itself. So you'll lift up. If you want to make it harder, you can lift your head up, lift your feet up. Hold 2, 3 for 1, and lower. Lift up. Hold 2, 3 for 2, and lift. Hold 2, 3 for 3. Lift. Hold 2, 3 for 4. Lift. Hold 2, 3 for 5. Lift. Hold 2, 3 for 6. Lift. Hold 2, 3 for 7. Hold 2, 3 for 8. Hold 2, 3 for 9. Hold 2, 3 for 10. Good. Let's do one more exercise here, strengthening the upper back. You'll put your arms out to the side. And then now, once again, you're going to lift those arms up, squeezing your shoulder blades back together. If you'd like to make that a little bit harder, you could lift your head up Now, as I'm lifting, I'm careful not to lift, like to flex my head or extend my head. I'm keeping my head in neutral, just looking at the floor in front of me. So I'm going to lift up here, hold 2, 3 for 1, and lift, hold 2, 3 for 2, lift, hold 2, 3 for 3, hold 2, 3 for 4, hold 2, 3 for 5, hold 2, 3 for 6, hold 2, 3 for 7, hold 2, 3 for 8, hold 2, 3 for 9, hold 2, 3 for 10. Very good. Let's come up to our hands and knees. So you're going to come all the way up to your hands and knees, and then place your knees underneath your hips. Your hands are underneath your shoulders, and let's start off by just dropping it back for a nice stretch. So here you're going to just take your hips, drop them back. If this is bothering your knees at all, you can just stop whenever you feel that you know that's about the limit for your knees, and you can reach your arms out in front. So if I am having any knee pain, I can simply reach out this way. If I'm not having knee pain, I can drop my hips way back, and I can go into a yoga pose known as resting pose. This is a good stretch for that low back. And then walk your hands all the way over to one side. And walk your hands all the way over to the other side. And then you'll come back up to the middle here. Let's gently come all the way back up to your hands and knees, making sure that your knees are under your hips, hands underneath your shoulders. Keep your neck in neutral. So in other words, I'm not going to flex my head, or I'm not going to really hyperextend it. I'm going to tuck the bottom under, rounding the spine. And then I'm going to go the opposite direction, arching the back. So I will round the pelvis under, tucking the head under, and then opposite direction. Okay, good, round the back, and opposite direction. Okay. Now let's return back to our neutral position. We can call this tabletop. So my neck is in neutral, kind of parallel to the mat here. And I'm going to add we call this revolved tabletop, where you're going to reach up with the right arm. I want you to turn your head to look up at your hand, so you're getting some nice extension and rotation at the neck. You're going to lift up and look up, getting that nice extension and rotation. You're also getting some nice strengthening in the muscles behind the shoulder to really strengthen those muscles that help hold your shoulders back for good posture. So nice and slow and controlled. Lifting here, looking up at the hand, and back. And back. One more on each side. from here, your hands are underneath your shoulders and knees underneath your hips. We're going to work the back by extending one leg, holding the leg out for a count of 3, and then bring it back in. And then other side, you're going to extend that leg, hold it up, hold for a count of 3, and bring it back in. So that would be the level 1 way to do this exercise. The level 2 would be a coordination of your opposite arm and leg. So you could try to hold those abdominals tight, holding that opposite arm and leg up, and then switching over to the other side. So you can choose how you do this exercise. Hold 2, 3, and lift. Now what I'm not doing, I'm not hyperextending. I'm keeping my legs straight with the rest of my body. My arm is straight with the rest of my body, holding the abdominals nice and tight, and then bringing the leg in. Other side. Hold 2, 3. We'll do 2 more. And last one. Good. Let's drop it back again for that resting pose. So just a nice gentle stretch for the low back, reaching the arms out in front, dropping the head back. And we'll come back up. And this time you're going to come onto your elbows and we're going to thread the needle. So you'll put your right palm up and you're going to reach underneath your left arm and look that direction of your hand so you can get a nice stretch for your upper back. Now, let's go the opposite direction. Place that palm up. You're going to look at that hand, getting some nice rotation for that upper back. Good. All right. So let's go ahead and come all the way back up again. Your knees are underneath your hips. Your neck is in neutral, and we're going to do an exercise for the cervical spine called a chin tuck. This is the ideal place to do this exercise, and this helps to strengthen these muscles in back of your neck and helps with correcting that forward head posture that we can get at our neck. So you're going to allow your chin to drop down a little, and then you're going to pull it straight up. So this one is almost like a rooster, where you're taking that chin towards the mat and pulling it straight back up. What you're not doing, you're not flexing your neck like this. You're actually, your head is remaining parallel to the mat, dropping the chin straight down and pulling the chin back up. An excellent exercise for strengthening the muscles in back of your neck. Really an important posture exercise as well. do 3 more. Allow the chin to drop back. Hold it up. Hold for 3. Good. Okay, good. All right, let's come around. Sitting in front here, you can put your left foot out in front, and then the right leg, you'll just bend the knee in. You have your yoga belt. You could use that yoga belt. Place that around your foot. Keep that back straight and chest up. Take a good deep breath in. And then you'll exhale and lean forward into that stretch, getting a good stretch here both in the hip as well as in the hamstring. Okay, and let's change sides. Okay, taking that leg in, keeping that back straight and chest up. Put the strap around your foot, and we'll take a good deep breath in. Exhale, lean forward into that stretch. Feeling a good stretch there. Good. And we'll sit all the way up, and let's go ahead and we will slowly stand up and do a few stretches in standing position. So you have your feet about shoulder width apart. Put the hands at the small of the back, and then you're going to lean back and look up. If you need to hold on to something, you can always hold on to your chair in front of you. Feeling a good stretch here for the hip flexor group as well as through the spine. And come all the way back up to neutral. Now then, let's put our feet together, knees together. Take your left or your right arm and take that all the way over. Taking the hip out to the side, getting a good stretch here through your side. And then other side. And then back. And then if you have a chair or a desk or something, we can do a nice stretch for your back. I love this one, and I love to incorporate this throughout the day, where you just hold onto a chair and then you drop your hips back, and you're going to feel just a nice stretch in that low back. This is a good, gentle, safe stretch for your back. And then take the hips over to the side. And gently over to the other side. Good. And then we'll gently walk all the way back up. And we'll come back around, and let's do 3 good deep breaths. So inhale up, and exhale. Inhale up, and exhale, and last one. Inhale up, and exhale. Thank you so much for joining us in our Core Hab program today. We hope you had a great workout. We hope you're going to join us next week as we provide a new program called Yoga Hab. Yoga Hab is an adapted yoga program that is designed and led by physical therapists. So you're going to learn how to manage joint pain by strengthening and dynamic stretching and breathing strategies in this Yoga Hab class. It's a nice, refreshing, active movement class that I know you'll enjoy. So we thank you again for coming to our class today, and we hope to see you again in our next week's Yoga Hab program.